The medical records of Ghanaians will never go back to the way. We are moving forward responsibly, confidently, and decisively. At this point, I would want to share with you facts inherited. In 2019, Ghana government signed a contract with a company called Lightwaves. And the contract sum was $100 million to connect 950 health facilities. The contract was supposed to expire in 2022. At the end of 2022, the contract was not well executed. And if I say not well executed, he had not connected the 950 facilities. And therefore, the contract was extended twice to expire in 31st December 2024. At the end of the expiration, out of the 950 facilities, only 450 facilities had been connected. At this point, you'd all agree with me that the contract was meant for 3 years and extended for 5 years for 950 facilities, and you have only delivered 450 facilities. Clearly, nobody needs to tell you that the company underperformed. And so when we took over, as part of the contract, they were supposed to hand over whatever they executed to the state. So the contract was divided into what we call milestones. Milestone 1, milestone 2, milestone 3. So at the end of each milestone, they are supposed to hand over to the state. You all agree with me that it's unconscionable for any individual or company to have access to the medical records, electronic medical records of Ghanaians without the state taking control, without the state having access to it, without having even access to the service. With a cloud infrastructure built somewhere in India. At this point, when we took over, we invited the vendor that the contract had expired and therefore they must hand over to the state. And so we needed to understand exactly what was taking over. So a forensic was conducted. And when we realized was that even the hardware, there were gaps in the supply of the hardwares. The supply of computers. If, assuming in the contract is stated that they should supply HP laptops, you go and cheaper brands are supplied. They should supply, let's say 100, you go and less than 100. So there were issues of quality of the equipment or material supplied, and there were issues of quantity, the number supplied. And so upon analysis, you realize that the gap alone was not less than $18 million. Again, I have stated that the contract sum was $100 million. At the end of 31st December 2024, although 450 out of the 950 had been connected, the vendor had been paid about $77 million. Clearly, more than 70% of the total amount had been paid. And 50% of the work has been done. At that point, we had to refer everything to the AG and the appropriate quarters, including the security, for advice and appropriate action. As a ministry, what we had to concern ourselves with was the solution of the matter to get out this mess. In order to avoid these disruptions and the shutdowns we are experiencing, although we didn't have any contract with the vendor as at the time we took over, we indicated to the vendor that it was ready to sign service maintenance agreement covering the 450 health facilities. Don't forget that the software is and was not for the state. That is why it's called LIMS, Light Wave Health Information Management System. It's not for the state. In the agreement, we indicated that before we sign such an agreement with you, you have to hand over the data to the state, and you must give us administrative access to the service. The vendor insisted that those clauses must be expunged from the agreement. We cannot expunge those clauses from the agreement because it is a state that's of these data. So the vendor decided to switch the system of as and when he desires and as and when he demands what. And this has some time now, more than 2 months. And for the past 2 weeks or so, completely down. If this is not blackmailing, I don't know what it is. At that point, what was important was to find a solution to get out of this mess.